Well, staying active in sports is a great way to keep in shape, but repetitive use can put a strain on your body. And one of the most common pains is golf and tennis elbow. Joining me this afternoon, Dr. Richard Busch with Busch Chiropractic Center. And doctor, first of all, thanks for being here. What's the difference between golfer's elbow and tennis elbow?
Well, everybody seems to get them confused, but golfer's elbow is where we start to notice pain on the front side of the arm and coming from the flexor muscles in your wrist. And tennis elbow is actually on the outside of your elbow with the extensor muscles in your wrist.
Now, can you get golfer's elbow from playing tennis or vice versa, or is it strictly from those activities?
No, you can certainly get it from almost any repetitive activity. Along with that, I see a lot of patients that have developed this during the course of the summer when they're out trimming bushes or when they're doing a lot of yard work, that type of thing, where you're actually doing repetitive stress injuries that actually cause those muscles to continually be either flexed or extended.
Now, how bad is that pain, and when do you kind of realize, like, hey, this is something I really need to take care of?
A lot of times we'll see just even, muscle tightness and tenderness and stiffness. But then along with that, we may notice some numbness or tingling or even some discomfort into the forearm, and then even maybe some wrist pain. Like I said, a lot of times those two things can be confused. And along with that, a lot of times patients will come in and they'll say, I think I have carpal tunnel syndrome. And so that's something else that sometimes may mimic these types of problems as well.
What are the type of treatments that are available?
Well, certainly we can do anything from just stopping that repetitive stress, which is sometimes for the golfers and the tennis players the hardest thing to do.
Very hard.
But then along with that, you can also ice, stretching. We can even use some different types of braces. Those types of things will help. And then along with that, we certainly treat a lot of patients with chiropractic care, where we may actually just gently manipulate the joint itself, where we move it a little bit and help take pressure off of that. And usually when I'm treating someone's elbow, we'll also treat their wrist as well, because those two joints really work pretty much hand in hand with this type of a problem.
That's a good one. Generally, how much time would it take, depending on the case, I know, but if someone were having that type of pain, how much time would it take to treat that?
In a lot of cases, as far as treatment, it doesn't take that long at all, a couple of minutes really. There are some cases where we may use things like ultrasound or some other different therapies to help with the inflammation in the area. I like to keep people away from non-steroidal anti-inflammatories because that actually slows down the healing process. And along with that, if you're masking that pain, in a lot of cases, they may actually continue to do the things that are actually causing it. So that kind of just perpetuates the whole problem.
And making it worse and extending it further.
Exactly. So if we can do things like, whether it's ice or rest and those types of things, light stretching, even light massage, and then along with that, like I said, some gentle manipulation in many cases will actually help with it.
All right, great advice. We appreciate that, doctor. You can find out much more about the Busch Chiropractic Pain Center. Just call the number right there on your screen. And right now, we'll send it over to Greg.